Wanawake tunakuletea ushauri wa Daktari Maranga ambaye atakuwa anatueleza moja kwa moja kuhusu magonjwa ambayo mwanamke anakabiliana nayo na hata matibabu. Mtazamaji, ni sehemu maalum na makala maalum katika jukwaa la wanawake, ukiwa nami Corazon Safan. Ni raha mpwito mpwito, zungumza nami ukiwa mahali popote. Nambari ya SMS ni 22047 na kule mitandaoni @TV47KE kwenye Twitter na hata kwenye Facebook na @Safan3 kwenye Twitter. Naam, shukrani sana kwa kutukaribisha kwenye hospitali yako, ama hospitali ambapo unafanya kazi. Najua kwamba umesema kwamba kizungu ndicho unakipenda zaidi, which is also very alright. Our audience is very flexible. Nikitazama kadi yako ambayo inanijuza zaidi, naona kwamba Dr. Aurora Maranga ni oncologist, ni gynecologist, ni obstetrician na pia ni laparoscopic surgeon. What does this mean? What is the definition of all these titles that you hold?
Well, it means that's the training. That's my training in terms of the kind of work I've trained to do, which basically means dealing with the issues to do with women's health in terms of during pregnancy, follow-up during pregnancy, during delivery, follow-up after that. That means obstetrician. Gynecologist means treating issues to do with women reproductive organs like infections, cancer, fibroid, cysts, and such like. Oncologist means dealing with cancers in women, which means cancer of the cervix, cancer of the vulva, uterine cancer, and ovarian cancer, among others. Yeah. Laparoscopic is a surgical skill. It's a surgical skill for when one is doing surgery, you don't have to open up the abdomen completely. It's also called minimal access surgery, which means we use cameras, we use probes, we use TV monitor or other, like monitors as we do the surgery. So it's not an open surgery. Yeah.
Inamaanisha kwamba unaangazia sana masuala ya wanawake, magonjwa ya wanawake, upasuaji wa masuala ya wanawake na mambo kama yale. Kuna jambo ambalo ni sugu sana katika jamii wakati huu ambapo sasa watu wanaamkia mambo mengi, kwamba there are very many infections. Kuna magonjwa madogo madogo na hata makubwa makubwa ambayo yanahusu haswa wanawake, women related infections. Haya ni kama yepi katika ujuzi wako?
The infections are many for women reproductive system. We have infections which are caused by bacteria. They can be caused by many organisms. There are some caused by bacteria, others by viruses, others by fungus. Others basically because they are hormonal changes, so there may be changes which may not necessarily be infection, but a lady may think it's probably an infection. Now, the commonest of them all is fungal infection, which we generally call yeast infection. Medically, we call it candidiasis. Yes. Now, this one is, or maybe let me niangazie hizo zingine ndio labda turudi kwa that particular one, yeast infection. So the others are bacterial infections, which could be sexually transmitted, like gonorrhea. Gonorrhea is very, very common. We also have chlamydia infections, among others, and others are herpes. Those are viral infections like herpes simplex infections. Others are human papilloma virus, but that one doesn't really have symptoms until it causes cancer of the cervix. Yeah.
You talked about, or you mentioned yeast infection. Najua kwamba hili ndio lile ambalo linapatikana sana na wanawake. Haswa inasababishwa na nini? Na mtu atajuaje kwamba sasa inaonekana kuna ishara kwamba amepata yeast infection?
The yeast infection, as we have said, is the most common. And the way it presents is with vaginal discharge, which is usually milky, kama maziwa lala hivi.
Inamaanisha kwamba ulipo popote unahisi kama kuna majimaji yanakutoka ambayo yanakaa kama maziwa.
And then apart from that, there could be like there's hardly like a foul smell with that one, but one could have itch, feeling itchy, kujikuna. That's another common symptom, which is usually there. Those are the two most common symptoms. The other one could be like some sores, feeling soreness in the genital area.
Panapokuwa sasa na harufu ambapo sasa kuna haya maji yanayokaa maziwa na pia kuna harufu, bado tunabakia pale ama sasa ni ishara ya kwamba ni jambo kubwa zaidi?
Hapa inamaanisha kwamba kuna ishara la another secondary infection, what we call bacterial infection. So when you have another bacterial infection on top of the yeast infection, that's when you start having the smell. Yeah.
What essentially is not even the word, lakini what causes yeast infection? Ni kipi ambacho kinaweza kutendeka mwanamke akajipata kwamba sasa kuna hili ambalo tunaita yeast infection?
Kinachofanyika ni kwamba sometimes somebody can get it from surfaces which are contaminated, like toilet seats, or maybe sharing personal effects like towels, soap, toiletries with somebody who has that particular infection. It's not considered to be a sexually transmitted infection. However, when it becomes very recurrent, we actually do treat plus the sexual partner, because through sexual contact, one may have a recurrent infection. And of note is it's a common infection in women, but also in men. It's only that in men we tend to have less of symptoms. So you find men could be silent carriers. So they have the infection, the partner could still get the infection from them, but they don't really individually have symptoms which can show that they have that particular infection. But having said that, some men would actually have the symptoms like feeling itchy. They could have a bit of rashes. And in others, really, the rashes can be quite sore, and that can lead to painful coitus.
Hivyo inamaanisha kwamba mtu ataiokota mahali popote ambapo atakuwa amekalia mtu ambaye ako na ugonjwa ule. Kama ni mtu ambaye ako na ule ugonjwa akakalia, mwingine akaje akalie, atapata ule ugonjwa. Kama ni taulo, kama mtu ambaye ako na ugonjwa ule atatumia, hata naye aje akatumia, basi atapata ule ugonjwa. Hii inamaanisha kwamba lazima mtu ahakikishe kwamba mazingira yake ni safi kabisa. Kuna wakati mwingine ambapo watu wanawake wanasema kwamba mara nyingi wao hupata cycle yao inapobadilika, kwamba kuna wanawake wanapata wakiwa karibu kufikia mwisho wa cycle ama hata mwanzo katikati. Kuna uhusiano kati ya cycle ya mwanamke, masuala ya pH balance na tena patikana na yeast infection.
Yeah. You're right in that particular sense, in the sense that yeast infection tends to be worse with the alkaline environment and least with acidic environment. So the acidic environment, that is usually the normal pH of the vaginal environment. But if that does change, the pH changes towards alkaline, then you tend to have more of the yeast infection. So in other words, if you find a situation whereby conditions which change the environment, the genital environment to alkaline, then you tend to have more infections. Exactly, yeah. That is, if somebody has any other infection in the body, even a cold or a cough, or a situation whereby they need to take an antibiotic, a broad spectrum antibiotic, that one tends to change the environment, the local environment of the genitals towards alkaline, and therefore makes it quite favorable for the yeast.
Kwa hivyo mtu anapopatikana labda na ugonjwa mwingine kama homa hivi, ama anapotumia madawa antibiotics, basi inawezekana kwamba pH itabadilika. Diet, kuna vyakula ambavyo mtu anaweza kula vikabadilisha pH kisha akawa na yeast infection.
There's a common practice. Some people tend to take more of yogurt, and they say it does help, but it's not a uniform thing which you can really say, okay, go and take yogurt, that it's going to help in this particular regard. But I know it is a common practice out here. But having said that, any environment which causes the immunity to go down, here we are talking about like during pregnancy, for example. During pregnancy, the immunity tends to go down. And you tend to have more of the yeast infections quite recurrent during pregnancy. You're also talking of other situations like in HIV or AIDS, where the immunity is generally down and maybe somebody is not on treatment. So you find they tend to have more of the yeast infections. The other situations are like if somebody is taking very strong medications, apart which could be antibiotics or even anti-cancer medication, then that would also lower the immunity and therefore predisposed to such.
Naam, kuna tunasema nini, mambo mitandaoni ama suggestion, ushauri mitandaoni, kwa vile umetaja kwamba mtu labda akiwa na ujauzito inamaanisha kwamba uwezo wake wa kukabiliana na magonjwa unarudi chini, basi anaweza kupatana na yeast infection, ama akiwa na ugonjwa ukimwi na atumie dawa na mambo kama yale, jambo lolote ambalo linaweza kushusha immunity ama uwezo wa kukabiliana na magonjwa katika mwili. Pale mitandaoni wakatoa ushauri kwamba mtu anapokosa kuwa na nafasi nzuri ya kutumia madawa ya hospitali kama anapokuwa labda na ujauzito, kwamba kuna mambo kama garlic, kuna mambo kama baking powder, there are very many things on the internet. Ni salama kujaribu kutumia ushauri kama huu ama lazima mtu atumie madawa ya hospitali?
You know, the thing about what you have mentioned about using the garlic or whatever the
homemade remedies. No.
In a sense, those really are harmless to the pregnancy. In any case, some of those are nutritious to the body, so we're not going to say don't take this, don't take that. There are types of foods which people generally use, including the yogurt, which has calcium, which is important for
ushauri ule hata unasema kwamba kwamba mtu aingize garlic ambayo umetolewa. Nilijaribu kuangalia mitandaoni, nikaona mambo ya ajabu kwamba garlic itolewe maganda kisha mtu aweze kuingiza katika sehemu ile ya mwanamke, ama aoshe na baking powder na mambo kama yale. Ni salama? Do they even work in the first place?
Sure, they don't work. Number two, they actually predispose one to other infections, because if you're putting their baking powder or you're putting their garlic or you're putting their stuff, foreign stuff, you may be introducing other infections, bacterial infections into that particular environment. As we have said, it depends on hygiene, as it were. And the other bit is if you do, or if one does insert some of those medications, they can actually cause problems in terms of fertility to such women. And I would give you for sure an example where we did treat somebody, and it's not one case, it's many cases, and many doctors, gynecologists will attest to this, where somebody has been using herbal ashes to treat like yeast infections, to treat many other similar infections, discharges and the like. And one goes on to develop what we call pelvic inflammatory disease, which now leads to infertility. And in a certain case, we actually started thinking the lady had cancer, and yet it was the ashes which she had used for a very long time, and therefore the whole area looked like we were having cancer, and yet it wasn't cancer.
Kwa hivyo ni vumbi ya kiasili ambayo hawa wanawake wanatumia, na kisha inakuja kuharibu ile sehemu zaidi, na ikaonekana nikana kwamba hata ni saratani, kwa vile inaleta uvimbe kwenye ile mifupa. Na wale watu ambao wana ujauzito mara nyingi wanaelezewa kwamba hawawezi kutumia sana madawa ya kutibu ama kuleta matibabu. Wao wanaweza kusaidika vipi? Do you have a solution for those who are not in a position to use the treatment, hospital treatment?
One thing is we are very keen during pregnancy not to use medications which can affect the baby or affect the mother in any way, but especially the growing baby, because our fetus would be very, very sensitive to any other medication, to any medication. So we tend to limit the prescriptions which we give during pregnancy, and we only give if it's really absolutely necessary, and we ensure that those medications are safe. So by the time you're giving prescriptions, it's because those medications are safe. And the reason why I'm stressing on that is the patients out there should really go to a qualified healthcare worker who can actually give advice and also give them the treatment which cannot affect the babies. Yeah.
Treatment labda funga swala la yeast infection. Treatment ambayo labda mtu anaweza kupata bila kuenda kwa hospitali ama lazima mtu aende kwa hospitali. Is it possible that someone can access treatment from the over the counter for this?
Some of those medications, like the creams, they are accessible over the counter. They're fairly safe to be given over the counter. They've been licensed over the counter. But generally, one would be advised, first of all, to seek medical advice, at least to be seen by a clinician or a doctor. Because some of those symptoms can actually be confusing. It's not so easy and straightforward that unless somebody has had that before, has been seen by a doctor, a clinician, then they can be sure it's a recurrence of the same. The reason why I'm stressing that is like cancer, for example. They'll still present with the vaginal discharge. They may present with a mix of yeast infection, bacterial infection, but underlying that is cancer. So one needs to be seen first, be examined, be done like even cervical cancer screening. It's ruled out. It's proven that it's actually an infection. Generally, we do take what we call high vaginal swab, where we take some specimen to take them to the laboratory to confirm that we're actually dealing with a yeast infection or a bacterial infection or any other infection that may be present. So what I would like to tell the public is go and be seen. And once it has been determined, then it's good to be treated for something which you are sure of. Yeah.
Umesisitiza sana kwamba wanawake walio na ujauzito wasije wakaogopa matibabu ya hospitali, waende kwa daktari. Daktari ataweza kujua madawa ambayo yanaweza kutumika kwa njia ya usalama panapokuwa na ujauzito. Hivyo si vema kwamba wajaribu kutumia njia za matibabu kule nyumbani wakiogopa ama wakihofia maisha ya mtoto ambaye bado yupo tumboni. Kuna wanawake ambao wamesema sasa haya ni mazungumzo tu kati ya wanawake ama watoto wa kike, kwamba kuna wakati mwingine mtu akichumbiana na mtu mmoja anakuwa anapata udhaifu wa kuweza kupata yeast infection, na anapochumbiana na mtu mwingine basi hapati udhaifu ule wa kupata yeast infection. Is it possible that there is a relationship between compatibility and getting a pH imbalance and thrushes and all that?
It could go back to what we earlier said about men being generally like carriers, silent carriers. By carrier here I mean they have the infection but they don't have any symptoms. So it's likely that if one is having one partner, that partner may not have or may not be a carrier. Having multiple, two or more, the higher chances that one of them may be a carrier and therefore may predispose one to getting that infection.
But it's not a question of compatibility, so that when one is not compatible with the other person. Another thing that maybe we should also bring to the light is that it is not necessarily a sexually transmitted disease, kwa sababu kuna nyumba ambazo zimevunjika. Nakumbuka kwamba kulikuwa na mhubiri aliweza kutaja mahali kwamba nyumba yake ilivunjika kwa sababu alikuwa anamshuku bibi yake kila wakati kwamba ametembea nje, ila baadaye akaja akagundua kwamba haya ni magonjwa ya uke tu.
Yeah, you are right. For yeast infection or candidiasis, it's not, strictly speaking, it's not a sexually transmitted infection. This is an infection which is very common in even girls' schools. You're talking about boarding girls' schools because they're sharing toiletries, they're sharing basins, they're sharing personal effects. So you find that for girls who are in boarding school, it's a common infection actually. And even within married women, if they're sharing stuff, it's also a common thing. So in other words, those who are sexually active and those who are not sexually active, they still get the same infection. And even when patients come to us in hospital, we treat, we counsel them, we tell them it's not a yeast infection. And generally we do advise that they come with their husband so that we are able to explain to them and also give them treatment. because there comes a problem if we only treat the woman, she keeps coming with the same infection, and maybe we need to treat the husband. And in instances where we give treatment to be taken to the husband, there are cases where the husband feels that maybe the wife it brings conflict. In other words, that's what I'm trying to say. Yeah.
Inaeleweka kwamba si jambo ambalo linafaa kuleta mgogoro kwa nyumba. Hata panapokuwa na ugonjwa ule, daktari aweze kuwaona wote wawili, kwa sababu huenda basi yule mwanaume ameweza kuokota ule ugonjwa na anafaa pia kupata matibabu. Basi nyumba zisije zikavunjika. What about cosmetics? Scented soaps, condoms, probably perfumes, lotions, mambo kama haya. Inawezekana kwamba sabuni ambazo zina harufu ama perfume ama manukato yanaweza kusababisha ugonjwa wa yeast?
Not really. Unless really somebody is applying there directly and therefore changing the acidity or alkalinity of the area. Otherwise, if somebody is just applying all over the body the way it should be done, really, it shouldn't really cause that infection.
Kwa hivyo kama mtu anampaka kwa mwili tu bila kupaka kwa sehemu ya uke haina shida. Lakini wakati ambapo labda mtu atatumia sabuni hizi kusafisha, kwa sababu haya yote ni mafunzo ambayo sisi tunapata pale nje, kwamba usiingize vidole ukisafisha kwa sababu hufai kuingiza chochote kule ndani, usipake sabuni yenye harufu ama manukato. Kuna uhusiano?
Hamna uhusiano vile. If I really heard you well, the advice is do not douche, meaning inserting fingers, cleaning over with soap inside. That should not really be done.
So cleaning should just be water and
yeah, just water, and that is it. The way the anatomy is, the area is supposed to clean itself very, very well. So it does clean itself very well. So you don't need to put soap inside or any other disinfectant to clean it up. Yeah.
Hivyo basi mtazamaji uweze kujua na kufahamu, kwa sababu hili ni jambo la kusisitiza kwa ajili ya watoto wadogo wa kike na hata wanawake, kwamba sabuni za aina mbalimbali na hata yale madawa kemikali ambazo zinauzwa kule dukani za kusafisha kule ndani hazihitajiki, kwa sababu daktari amesema kwamba mwili unajisafisha wenyewe, tumia tu maji na basi yakatosha. Daktari, kando sasa na yeast infection, kutakuwa na tofauti gani kati ya yeast infection yale yote ambayo ulikuwa umetaja ambayo sasa yanaonekana kwamba yanasababishwa na kuchumbiana kingono?
Now, there are the other infections which could confuse the pictures. We have said yeast infection or candidiasis as we call it, it's not a sexually transmitted infection per se. But then it may come across or it may come around with other infections which are sexually transmitted, like gonorrhea, chlamydia, and several others which are sexually transmitted. So in other words, they could confuse the picture, or they could be there. Two or more infections can coexist at the same time. So that is why I was insisting that if there are symptoms, somebody should actually go to the hospital and be reviewed and be seen.
Kwamba magonjwa haya yanayosababishwa na kuchumbiana kingono na mtu ambaye anayo kama gonorrhea, syphilis, yanaweza kukuja pamoja na yeast infection, mtu akawa nazo mara moja. Kutakuwa na tofauti gani katika symptoms? Ishara sasa zitakuwa tofauti kwa kiwango kigani ama kiasi gani?
The difference there, you could have some infection, you could have like a discharge, which is not really like milky, but you could have like pus. So it becomes like pus, comes out, it's yellow, it looks like frank pus. It has a smell and a very foul smell. So that if somebody is even seated somewhere, the next person could actually smell.
Harufu, basi ukisikia harufu katika yale majimaji ambayo yanadondoka, ujue kwamba sasa ni jambo tofauti, unafaa kwenda kumuona daktari. Mambo kama contraceptives yanaweza kusababisha kudondoka kwa majimaji katika sehemu ya mke?
Contraceptives, not really. Except that those who use coils, those who use the coils. They tend to have more secretions than those who don't use coils. And because they tend to have more secretions, there may be a change in the pH, in the acidity of the vagina, and that may precipitate a yeast infection or maybe make it easier for them to get sexually transmitted infections. So what I'm trying to say is the coils do not cause sexually transmitted infections, but they make one more likely to pick it than somebody who doesn't have it. Yeah, and it tends to give more complications.
Kwa sababu tumeambiwa mara nyingi kwamba ukiwa na coil, ukiweka coil utaweza kupata magonjwa kama haya, au umeweza kuyakinisha na kudirisha kwamba coil yenyewe haisababishi magonjwa katika sehemu ya uke, ila inakufanya uwe na udhaifu ama unyonge wa kuweza kupatikana na magonjwa kwa sababu inabadilisha pH ama mazingira ya sehemu ya uke. Kuna jambo ambalo ni swala tata sasa katika jamii yetu. Nasema ni swala tata kwa sababu hata mimi wakati mwingine nikifikiria hunipa hofu kidogo kwamba sasa tuko na mambo ya saratani katika jamii, saratani ya sehemu zote za mwili. Na mwanamke hushangaa kwa sababu kila mara kuna mabadiliko katika mwili wa mwanamke na sehemu ya mke. Ni vipi mtu ataweza kujua kwamba sasa niko na ishara ambazo zinafaa kunipeleka kuchunguzwa niweze kujiepusha na saratani ya sehemu ya uzazi?
Some of the symptoms are the ones which you have talked about. Because cancer, for example, of the cervix, cancer of the genitals, may actually have symptoms which are non-specific. Could still present with vaginal discharges, and could also have the yeast infections, the bacterial infections, the viral infections. So those can actually all confuse the whole picture. But generally speaking, if a lady has abnormal and frequent vaginal discharge, then they should actually be seen. And especially if there is a foul-smelling vaginal discharge, which sometimes can come with blood stains, or if there is bleeding during or after intercourse, that needs to be investigated. Then if there is pain during or after intercourse, that also needs to be investigated. One needs to see a doctor to determine whether it's just an infection or there could be some cancer cells or cancer developing in the background. Yeah.
Kwa hivyo unamaanisha kwamba kudondoka kutoka kwa sehemu ya mke, yale majimaji hayafai kuchukuliwa na uwepesi. Mtu anapoona yale majimaji yakimdondoka kama discharge ikimtoka, aweze basi antena ziwe juu, atafute daktari. Kuchumbiana, mtu anapochumbiana akasikia uchungu baada ama kabla, basi aweze kuona daktari. Ama panapotoka damu kutoka sehemu zile, aweze pia kuona daktari. Najua kwamba bado hatuja kuwa na sayansi ya madhibitisho wa kisayansi ya kujua kwamba ni kipi kinasababisha saratani ya sehemu ya uzazi. Lakini je, katika ujuzi wako unaweza kusema kwamba labda kuna mambo mawili matatu ambayo yanamweka mwanamke awe na unyonge wa kuweza kukabiliana na kupatana na ugonjwa huu?
In a large way, we actually know what causes some of these cancers. The commonest in this country and in sub-Saharan Africa is cervical cancer. And cervical cancer, we do know 100% what causes it. It's caused by human papilloma virus, which we generally call HPV virus. It's a virus, as the name implies. Now, this is the commonest infection, commonest sexually transmitted infection in human beings globally. And it is so common, but it doesn't have symptoms. And if you look at a population, by the time one reaches 60 years old, you'll find almost 90% of that sexually active population, they have had HPV sometimes in their lives. But only less than 5% would go on to develop problems with the presence of human papilloma virus. So what I'm trying to say is, for cervical cancer, we do know what causes it. And the good news about cervical cancer, as much as it's the commonest in the country and in the region, there are ways in which it can be detected earlier. One, there's a ways in which it can be avoided, and there are ways in which it can be detected earlier and be treated earlier. Now, if you talk about prevention, well, maybe easier said than done, but abstinence is absolute in that particular area, and especially if you're talking about young girls and young people, so to speak. So if one was to delay sexual debut at the age at which one starts sexual activity, then that does help a lot in terms of prevention of human papillomavirus infection. The other bit is about having multiple sexual partners, and the other bit is doing frequent screening. And that's why it is recommended that a lady should actually have annual checkup by doing, which includes, apart from breast examination, to have pap smear, which is really cervical cancer screening. And the other good news about it is, and I think we are all aware, the government is now rolling out human papillomavirus vaccination. At the moment, I think it is being targeted at around 10, 11, 12-year-olds. And I think that's a very good program, because we are looking at converting the future generation to cervical cancer-free generation.
Naam, kwa sababu unajua kuna watazamaji wengi, najua kwamba wangehitaji pia nao kuelewa kwamba saratani ya njia ya uzazi mshajua inasababishwa na nini? Inasababishwa na human papilloma virus, ambayo ni virusi. Inasababishwa kutoka kwa kuchumbiana kingono na mtu ambaye tayari hakuna virusi, na ni kama ni jambo ambalo lipo ingawa ishara hazionekani mara zote. Inamaanisha kwamba wanaume wanabeba virusi vile kwa wingi sana, na mtoto wa kike anapongoja ama anapojishikilia asije akajiunganisha kingono hadi miaka ya baadaye, basi ni bora zaidi, ama mtu awachane na ngono kabisa. Atakuwa basi ameepukana nayo kabisa. Tukimalizia kisehemu hiki ndipo basi uweze kutuonyesha kabisa. Watu wana hofu ya kuweza kuangaliwa ama kutembelea vituo ama hospitali kuangaliwa pap smear. Wanasema kwamba kuna mambo ambayo hawaelewi, kwamba labda kuna uchungu pale, labda kuna mambo ambayo yatatendeka pale ambayo hayatawafurahisha. Why is it that the population has not embraced pap smear that much? Kwa nini watu wengi hawajakumbatia kukaguliwa na daktari katika sehemu ya uke?
I think one of the main things is it involves a very private part of the body. So most people naturally will feel their privacy is being invaded when they come to hospital, for them to address to the doctor, whether it's a male doctor or a female doctor, and then to be seen, because it's a very intimate examination to access the cervix. So, and then there are also many myths about the actual examination. That's very, very painful. Sorry. That's very, very painful. And I've met many women when they come for the first pap smear. They usually tell me stories how they are dreading, how they have taken a long time. Others would have thought about it and taken even 6 months, 1 year, just planning to come, even 2 years planning to come for a pap smear. And it's more of anticipated pain. And most of the time after the procedure, they would usually say they had the wrong notion about it, that it was not as painful. In fact, not painful at all most of the time. It's really the anxiety about it and what people have heard about it out there. So I would actually assure the public, and especially the women, that it's not true that it is that painful if it is done in the right way by somebody who is well versed in doing the actual procedure and in the right environment. It's very, very safe, it's painless. And then even if it was painful, just in case it was painful, look at it on the pros and cons of not doing it. If one doesn't do it and by bad luck somebody gets cervical cancer, which is the more painful of the two? One is probably the anxiety of it and the physical discomfort of going through the procedure, but the other one then it's life-threatening. So one has to look at the benefits and the risks of doing it, and of course doing it and doing the screening wins all the time.
Ni maamuzi ya kimaksudi kwa sababu si uchungu. Wakati mwingine watu wanasema tu, lakini ukifika pale wenyewe ukakuja ukajua ukafanyiwa, utagundua kwamba si uchungu kabisa. Tutazungumza kuhusu kama kuna tiba ama management ambayo iko katika taifa letu. Lakini mtazamaji, ningelipenda tuweze angalau kupata dakika chache tukapata kopo la maji, lakini nakusihi usibanduke. Tukirejea tuko katika hospitali ukitazama, na hii ni sehemu ambayo inaitwa procedure room, na wakati ambapo labda utafika hapa kuja kukaguliwa na daktari sehemu ya uke ama sehemu ya uzazi, utapata mahala kama hapa, ila kuna mahala kwingi sana. Tungelipenda basi kuonyesha ni kipi ambacho utatarajia wakati ambapo utakuja hapa, ili uweze kujua kwamba yale ambayo yanasemwa nje na yale ambayo yako hapa huenda hayajaambatana. Daktari, hivi vinaonekana kwamba ni makasi, ni visu na ni vya chuma. Vinatisha kweli. Kazi yao ni nini, na je, nafaa kutishika ninapoviona?
Most of these instruments, they are not related to what we have just discussed in terms of screening for cervical cancer and diagnosing it and pap smear. They're not related. These are instruments which we use in theater, which is main theater, when a patient is under anesthesia. So if a patient has come for maybe abdomen to be opened up, for us to remove the uterus, even cesarean section. So those major operations, some of the instruments are here. And this one is, we call it it's a forceps, or non-tooth, because it doesn't have anything here, so we call it non-tooth. It's really for picking up stuff, yeah, like picking up like this. So if I'm picking up a tissue, and then I could actually cut using a scissors. I could actually use a scissors, yeah, these are scissors. So I pick up and cut. So I could pick up like this and then I cut that particular tissue. Yes. So hii ni makasi yenye iko carved, as you can see it is carved. Kuna zingine ambazo ziko straight scissors, hizi ni za kukata uzi. So nakata uzi namna hii ni ya kukata tissue itself. Yeah, kama ni nyama ya kukatwa during the operation, that's what we use. Kama hii ni ya, it's basically for retracting a vessel, retracting some tissue away from where one is operating. So this one pulls off from the field where we are doing the operation. Other instruments here, like this one. This one could be used. It's called an Ovum Forceps. As the name implies, we use it especially if we are cleaning up a lady who has a miscarriage, and this one and has a big clot or big tissue, and the cervix is open. Then we use this to retrieve that tissue from the uterus. This one here is called a sound. A sound is basically an instrument we use. If you look very keenly, it has calibration. So it usually helps us to measure if we are dealing with the cervix. We insert it into the cervix and we are able to know how far the upper part of the uterus is from the cervix. So if you're inserting a coil, for example, or any other device into the uterus, we're able to measure so that we don't really go and perforate, go through the uterus and cause injury.
Because it's actually calibrated. Naam, shukrani sana daktari, na jua kwamba wakati umefika wa kufunga, lakini nafahamu fika kwamba kila mwanamke ama kila mtoto wa kike ama hata wale ambao wana shauku ya kujua masuala kama haya wameweza kujifunza mengi sana. Janice Cancer Center, mahali ambapo unafanya kazi, najua kwamba ni mahala maalum sana kwa sababu kuna wengi ambao wamezungumza vema sana kuhusu wewe, na ndio maana hata nikakutafuta na kuhusu Janice Cancer Center. Yule mtu ambaye ana nia ya kutafuta usaidizi ama ushauri anaweza kupata Janice Center ama kukupata kwa njia gani wakati kama huu?
Tuko huko Janice Medical and Cancer Center, cancer hospital so to speak, because we have inpatient, outpatient, We treat cancers, all types of cancers. Myself, as a gynecological oncologist, I treat female cancers. We also have colleagues who work with us who treat all the other types of cancer. So the public, they are welcome to come. If there's any need for any consultation, for second opinion, we are able to deal with that. We work with many other specialists in this particular area. They can find us. We are located near Mbagathi Hospital, inside Sunview Estate, which is opposite Kenyatta Market, where formerly we used to have Great Lakes University of Kisumu, Nairobi campus. That's where we are located. You can get us online. My number, I think it can be provided.
Ama unaweza kusema hewani moja kwa moja kama lakini kama watanifikia mimi nitaweza kuwapa nambari. Hivyo basi wale ambao wanataka ushauri kuhusu masuala ya saratani waje, wale ambao wanataka ushauri kuhusu masuala ya uzazi waje, na hata upasuaji wa aina mbalimbali. What makes Journey Center unique as a place so that somebody should actually realize that they're in a unique place when they get here?
When they come here, we give comprehensive treatment in terms of screening, in terms of actual diagnosis. If surgery is indicated, we'll generally do the surgery. If it's chemotherapy which is needed, we'll actually do the chemotherapy bit of it. And if it's radiotherapy, then we link you up with where radiotherapy can be done. So it means that we can actually do most of the treatment for the cancers. I must hasten to say also that we actually do treat the other illnesses. Women do still come here for deliveries. They also come for cesarean sections. Men also come for prostate check or for any other ailments. So as much as we call ourselves a cancer hospital, it's because we want to give the best, especially for cancer, because it's one of those neglected areas, but we also do treat the others. The viewer, if you want to get more information or you want to make booking, you can always dial us on 0714 734343.
Utafikia Journey Center. Shukrani sana kwa wakati wako. Najua kwamba umekuwa ni wakati mgumu sana tukaweza kukamilisha haya, lakini shukrani sana, na najua kwamba wale ambao watakufikia na watafikia hapa wataweza kupata usaidizi. Msaidizi na tena daktari Maranga ameweza kutuelezea moja kwa moja mtazamaji njia za kuweza kukabiliana ama njia za kuweza kutazama ishara za magonjwa haya yote. Ungelitaka ushauri zaidi, basi zungumza nami, nambari ya SMS ni 22047 au kule mitandaoni @TV47KE kwenye Twitter ama kwenye Facebook niweze kukuambatanisha ama kukutanisha na Daktari Maranga. Shukrani sana kwa kuchagua runinga ya TV47 na haswa jukwaa la wanawake, ukiwa nami Corazon Safan. Hadi hapo siku nyingine tukiangazia masuala yanayotuhusu sisi kama wanawake. Nasema shukran na asante.